All right, CPR part 2, giving CPR to an infant.
If an infant is unresponsive and not breathing or only gasping, assume cardiac arrest and begin CPR. Ensure the infant is on her back on a firm, flat surface such as the ground.
The baby's unresponsive.
Next, stand or kneel to the side of the infant and place 2 fingers on the breastbone just below the nipple line with your hand closest to the infant's feet. Now, give 30 chest compressions. Using the tips of your fingers, push down about 1.5 inches, and then let the chest return to its normal position. Continue to push hard and fast, giving compressions at a rate of between 100 and 120 compressions per minute. After the 30th compression, prepare to give 2 rescue breaths. First, place a breathing barrier over the infant's nose and mouth. Then, open the airway by putting 1 hand on the forehead and 2 fingers on the bony part of the chin and tilting the head back to a neutral position. Make a complete seal over the infant's nose and mouth with your mouth. Blow for about 1 second while looking to see that the chest rises. Take another breath, make a seal, and give a second rescue breath. Continue giving sets of 30 chest compressions and 2 rescue breaths until you notice an obvious sign of life. An AED is ready to use and no other trained responders are available. You have performed 5 sets of CPR and another trained responder is available to switch. You have performed 5 sets of CPR, you are alone and need to call 911. EMS personnel take over. You are alone and too tired to continue, or the scene becomes unsafe.
I have the AED in the first aid kit.
22, 23.
This video will be about practice. We're just going to watch a little bit about kind of the pace. I want you to notice the pace.
Okay, it's chest.
CPR.
Make sure your fingers count out loud. Ready?
You should
Begin.
count out loud as you perform CPR.
2 and 3
3
and
and
4
4 and 5 and 6 and 7 and 8 and 9 and 10. Notice how his elbows are locked out. Shoulders over top of the chest. Help with fatigue so he can use his own body weight.
26, 27, 28, 29, 30.
Now he's going to get
Pinch the nose,
his
make
breathing
a seal,
barrier.
and give 2 rescue breaths.
Notice the chest rise.
Immediately give another 30 chest
Going
compressions.
right back to his next set of chest
Remember,
compressions.
compress at a rate of 100 to 120 compressions per minute, and a depth of at least 2 inches for an adult. For a child, compress at a depth of about 2 inches.
30.
Great job. Now give 2 rescue breaths.
Notice that chest rising.
Now back to chest compressions.
1 and 2 and
Good.
Again, that
You can now
continues.
take a rest.
Until you notice an obvious sign of life. You become too exhausted to continue. The scene somehow becomes unsafe. Another trained personnel arrives to take over. Here's the same situation for an infant.
Okay, on, and your breathing barrier nearby.
PPE's
Next,
on.
place
Personal
2 fingers,
protective equipment.
count out loud, at 30 compressions.
2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11.
Now place the breathing barrier and open the airway position.
Remember breast.
Make a complete seal over the mannequin's nose and mouth with your mouth.
So you see the chest clearly
Give 2
rise.
breaths. At a rate of 100 to 120 compressions per minute and a depth of about 1.5 inches.
Trying to get 100 to 120 compressions in a minute, which is moving pretty quick.
Rescue breaths. Rest.
So, if the first rescue breath does not cause the chest to rise, you should retilt the head, ensure that the airway is properly open, and ensure that the person's nose and mouth are properly sealed before giving the second rescue breath. The second, and this is important, if the second rescue breath does not make the chest rise, an object may be blocking the person's airway. Even if that's the case, we go right to compressions. We never give more than 2 rescue breaths. Compressions of the 2 are more important than rescue breaths. So we can't spend too much time on rescue breaths when we're wasting time doing the chest compressions. The chest compressions, we are acting as the heartbeat for the person. And we need to pump circulate the blood to the brain so the person's brain does not die. After the second set of compressions and before giving rescue breaths, you can look in the person's mouth to see if there's an object there. If you see it there, then remove it. If you don't see one, you can try and give 2 more rescue breaths to see if the air will go in. If not, we're back to 30 compressions again. To remove the object, you can do a finger sweep. Be sure that you actually see the object in the person's mouth before attempting to remove it. After removing the object, then you'd give 2 breaths again. Here's a video. We're going to play through it kind of quickly, showing what happens when the chest
The chest should rise. Situation where the chest
putting
rises.
PPE.
If the chest does not rise on the first breath, reopen the airway, make a seal, and try a second breath. If the chest does not rise on the second breath,
Again.
set of chest.
1920.
For attempting rescue breath, object. If you see
There's
an
that
object,
30.
remove it
There's
with
an
a
object
finger
there.
sweep.
You can
For an
remove it.
adult, use your index finger. For a child or infant, use your little finger. Give 2 rescue breaths
gives 2
and
breaths.
continue CPR.
You see that the chest rises. If you're unable or unwilling for any reason to perform full CPR, which is 30 chest compressions and 2 breaths, that's 1 cycle, give continuous chest compressions at a rate of 100 to 120 compressions per minute, minus the rescue breaths. Make sure you call 911 first, and then you continue giving chest compressions until another trained responder or EMS personnel take over, or you notice an obvious sign of life. So you can do compression-only CPR if for whatever reason that you are unwilling or unable to give rescue breaths. Now, if we were in a classroom, we have the putting it all together scenarios with our mannequins, you and a partner. This scenario says you and a coworker are taking inventory. You hear a gasp, and you see one of your coworkers fall to the ground. So the first thing we need to do as we approach the coworker is check for responsiveness. Tap them on the shoulder, shout their name for no longer than 5 to 10 seconds. Now, if they remain unresponsive, we tell someone to call 911. We tell somebody else to get the AED and the first aid kit. There, we would start our CPR of 30 compressions and 2 rescue breaths. In this situation, it's a 9-year-old child, that goes down at a volleyball game at a family picnic. In this situation, if the parent or guardian is around, and you'll know if they're around, they'll be right around the child screaming, you need to ask for permission, for consent, before you were to give any CPR. Again, you can still tap on the shoulder, try and check for responsiveness for 5 to 10 seconds. You tell someone to call 911. There by chance was a first aid or an AED kit around, have somebody get that, and then you'd start CPR with consent from the guardian. Similar situation back in the grocery store. You see the mother and her child there, her young baby, and the person behind her notices that the baby is turning bluish in color. So again, you tap mom on the shoulder, let her know what's going on, tell her who you are, that you're trained in CPR, and ask for consent to help out. In most cases, the parents will give consent, unless of course they know CPR themselves, and they'll probably try to be the ones that would save their own child.